This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. The emergency department can sometimes be a fast-paced and stressful environment where critical decisions about medications must be made in less than ideal circumstances. With a grant from the Jewish Healthcare Foundation, the UPMC Shadyside Pharmacy Department was able to trial the expansion of their unit-based pharmacy services to the emergency department. As a result, there are now 2 ED-based pharmacists in place.
I was asked to do this because I worked in many areas in the hospital prior to the emergency department, so I'm used to adapting to the shift I'm scheduled to, working with the people that I need to work with, and establishing good relationships in a short period of time.
My name's Casey. I'm a pharmacist.
We can expedite care to the patient by being physically on site in the emergency department.
And on your deep inhale, it's kind of like a little coordination, but as you're deeply inhaling, pressing down on the canister.
It just squirts out once, right?
Exactly.
Okay.
We as pharmacists have the time to sit down with the patient for maybe a longer period of time than the nurse or the physician would to thoroughly go through the medication with the patient, make sure they understand how to use it correctly, and also warning signs about when they should seek medical attention in the future. I have not been trained in emergency medicine, so it was a huge learning process for me as well. Initially, the response from the staff was a little mixed, and now that I've been there for about 19 months, it's more, I don't know what we would do without you. A lot of the education we do is informal, so if we can get a couple nurses rounded up around the nurses station at a time, we'll quickly go over the information in 10 to 15 minutes, everything that they need to know about a medication. A lot of times during the day, the physicians will ask me questions.
I'm an 81-year-old female coming in from a nursing home with suspected aspiration pneumonia, and I need to dose her correctly with antibiotics.
Perfect. Does she have any allergies to medications?
None that she is aware of, but she's a poor story.
Okay, and how much does she weigh?
She's about 57 kilos.
7 kilos. Why don't we just do Zosyn Vanco, do 4.5 grams of Zosyn, a gram of vancomycin, we'll go from there?
That sounds good.
Okay, wonderful.
Okay, thank you very much.
We can also assist in life-threatening situations and code situations where obtaining a medication, mixing it appropriately, dosing it appropriately, and administering it to the patient is really sometimes the difference between life and death.
Partial possible overdose. They gave her Narcan in the field. She has a 20 gauge in. She has a pulse. She has a blood pressure persisting her breathing, and she continues to be unresponsive.
All right, Casey, can we get 0.4 milligrams of Narcan?
Coming up.
If a pharmacist was not on site for a code, a nurse would be responsible for obtaining the medications and preparing them for administration. In a critical situation, we need nurses available to start IV lines, monitor the patient, do charting, and also get the patient any other things that they may need that aren't related to medications. If you can decrease adverse drug events, you are going to see a decrease in cost to an institution. If you can help expedite a medication to a patient appropriately, you can maybe decrease length of stay. I can collaborate with nurses, physicians, social work, respiratory therapy, medics. I mean, the true collaboration I really enjoy to get the best outcomes for a patient. Over a 1-year period, I was able to document over 2,000 interventions for patient care that was associated with a cost avoidance of $609,065. And a great improvement in staff satisfaction from baseline before having a pharmacist in the emergency department. I never thought that it would go so well. And I think that's what I'm the most proud of, is that we're expanding and that the relationships that I've formed with the physicians and the nurses have been so strong. I think that's what makes me the happiest about it, is knowing that they truly appreciate having a pharmacist on site.